afternoon, everyone. Thanks for joining us. I'm Janelle Slade. In the midst of rising confirmed coronavirus cases and deaths across Yellowstone County, today, Health Officer John Felton is addressing the community to talk about the new mask directive from the governor and future community testing challenges. We now go live to Yellowstone County Health Officer John Felton at RiverStone Health.
This month alone, Yellowstone County has reported 458 new cases. That's more cases than our county had in the previous 4 months combined. Among the 629 cases reported in Yellowstone County since the pandemic began on March 13th, 440 of those are active right now. Nearly 1/3 of all of the 1,226 active cases in Montana are in Yellowstone County. Today, there are 24 people confirmed to have COVID-19 hospitalized in Yellowstone County, and this constitutes 65% of all the people hospitalized in Montana with the disease. With respect to senior living facilities, an update on that. As you'll recall, on July 3rd, I issued a health officer order which restricted visitation, except in cases of end-of-life and compassionate care visits, to all senior care facilities in the county due to the increase in the number of staff and residents who tested positive for the COVID-19 virus. To date, Yellowstone County has reported 112 positive tests among residents and staff at our senior living facilities, including 91 people at Canyon Creek Memory Care. Those other 20 positive cases are distributed among 7 other facilities. So we have a total of 8 senior living and care facilities thus far that have been impacted by positive cases. Tragically, we've lost 14 Yellowstone County residents to this disease. 9 of those who died were residents of Canyon Creek Memory Care, and 1 was a resident of another assisted living facility. In terms of how we're seeing cases, we have seen clusters of people being infected by the novel coronavirus in local businesses, in group homes, and in other congregate care facilities. Right now, all roads lead to Yellowstone County. Yellowstone County is the epicenter of the pandemic in Montana. The Montana Department of Public Health and Human Services has linked cases in Yellowstone County to 13 other counties and 2 Indian reservations. Those are linked to exposures to Yellowstone County residents and/or activities and events occurring in our county. These other sites include both the Crow and Northern Cheyenne reservations, Custer, Carbon, Bighorn, Rosebud, Valley, Gallatin, Roosevelt, Wheatland, Fergus, Webo, Deer Lodge, Stillwater, and Treasure counties. I want to talk a little bit about events in our county. I want to make it absolutely clear that RiverStone Health neither approves nor rejects event plans. We can only provide recommendations, which we are happy to provide on request to anyone who would like to plan an event. Those event organizers may choose to use our public health recommendations or to disregard them. Simply asking for recommendations does not mean the event organizer has received approval or sanction from RiverStone Health. I mention this because there's been some recent events that have stated in public promotions that they have RiverStone Health's approval to proceed with their gatherings. This is not correct. We do not approve those gatherings. It is the responsibility of the organizer to comply with all requirements issued by the governor and any other orders that are in place. This spike in COVID-19 cases in our county has stressed our public health system to its maximum. RiverStone Health has hired 17 temporary staff members in the past week to help with contact tracing, testing, screening, and data analysis. We are still accepting applications for more temporary workers, and I would encourage folks who would like to be a part of the solution to consider making those applications. A number of RiverStone Health employees are still redeployed from their regular duties to assist with COVID-19, and many RiverStone Health employees continue to do their regular work and take on additional work in the evenings and weekends with respect to COVID-19 tracking and prevention. This pandemic has put a spotlight on the limited resources of U.S. public health. There are significantly fewer public health workers nationwide now than even a few years ago. Funding usually goes up in a disaster and then disappears, leaving our public health system far less prepared for the next inevitable disaster. I want to talk a little bit about some issues that are going on with contact tracing and case investigation. With the resources that we have and the resources we've added, we are doing our very best to manage notifying people of their test results in a timely manner, but we need the help of the public. Our contact tracing has been slowed because people do not answer their phone or don't return calls from public health. I'm asking every resident to help stop the spread of this virus by returning our calls and cooperating with our instructions. RiverStone Health calls every person who has tested positive for COVID-19 who lives in our county, and we call everyone in our county who's been named as a close contact of a positive case. If each of our current 440 active cases has just 5 close contacts, and I can assure you that is on the low end, that means there are at least 2,200 people that either should be isolated if they're ill or in quarantine for 14 days. This means they're out of the workforce and unable to participate in their preferred summer activities. To differentiate those two things, isolation means that you're isolated from others because you are ill. Quarantine means that you are well, but you've been exposed and we're concerned you might develop COVID-19, and therefore you shouldn't be at work, you shouldn't be running errands, or leaving your home for 14 days. We do know that some people who are in quarantine are out and about, running errands, doing that sort of thing, going to their friends' homes. They need to stay home. People are in quarantine for a reason. And that reason is that people who fail to isolate or quarantine can infect others, leading to a growth in cases. Just this last week, we've had 256 cases reported in Yellowstone County, and that's nearly 56% of our cases since the first of the month. Let's talk a little bit about testing. Since July 11th, RiverStone Health has provided more than 1,000 free COVID-19 tests through our testing event at Metro Park on the 11th and our weekday mornings at the Shrine site that started July 13th. During the governor's press call yesterday, he talked about the nationwide backlog of testing results. Governor Bullock announced that Quest, the lab that our state contracts with to run asymptomatic tests, has ceased accepting cases from Montana for the next 2 to 3 weeks. This announcement obviously affects RiverStone Health's ability to continue our testing at the Shrine as planned. For the remainder of this week, we will continue testing people who do not have symptoms at the Shrine, but we cannot say how long it will take to get those results back. We simply do not know. We will also continue to test people who have been identified by RiverStone Health specifically as close contacts to people with COVID-19, as well as anyone who has symptoms of COVID-19. The lab situation is changing very rapidly and pretty much on a daily basis. As we learn more about the lab situation and the capacity for that testing, we'll let you know how our plans might change. I also want to take just a minute to address a rumor about people who have never been tested for COVID-19 and then claim to have received a call from RiverStone Health telling them they are positive. This is simply not true. There is no way that we would have any person's contact information if they did not get tested. Let's talk about the masking situation a little bit. With 56% of our July cases being reported in the last week, it's clear that we all need to do better. This is why RiverStone Health strongly supports everyone wearing face coverings in public indoor spaces as the governor has directed, as well as in outdoor spaces when appropriate physical distancing is not possible or is not observed. And I would underline that from the governor's directive. Universal masking has been shown to dramatically decrease the risk of the novel coronavirus being spread from person to person. Just this week, the Centers for Disease Control and Prevention released information showing that wearing a mask prevented the spread of infection from 2 sick hairstylists to their 139 customers in Missouri. Both of these people were sick. They both wore masks. They didn't infect anybody. Everyone who wears a mask is helping keep their neighbors safe from the disease and helping to keep our local businesses open. Rather than ordering businesses to close, the governor chose to direct all Montanans to act responsibly to slow the virus spread. I applaud our local Billings area business leaders who are distributing masks and encouraging employers to have their workers and customers wear masks. I also commend the Bobcat and Grizzly football coaches for their work leading the Mask Up Montana campaign. In closing, before I take your questions, I'd just like to say this. Slowing and ultimately stopping the spread of this novel coronavirus cannot be accomplished without all of us doing our part. On their own, public health, local healthcare and hospital systems, and our businesses, no matter how hard we work and how much we do, we cannot stop the spread of this disease on our own. It is the action that each one of us as individuals take that will ultimately save our community from more sick people, more grieving families, more lost jobs, and more closed businesses. All of us simply need to follow the 3 W's. Wear a mask, watch your distance, and wash your hands. I'm fully aware that some of you out there think the masking order is way overdue. Others of you believe that COVID-19 is not that big a deal and should not interfere with anyone's life. Let me assure you, COVID-19 is a big deal. The families of grieving 14 dead Yellowstone County residents certainly believe it's a big deal. Our 440 sick friends and neighbors who are isolated at home, and the several thousand close contacts in quarantine who are not working and are spending their summer behind closed doors, believe this is a big deal. The businesses that are limited in their operations, operating on a shoestring, or are closed, believe this is a big deal. The millions of Americans who have lost their jobs think COVID-19 is a big deal. And I can assure you, the residents and staff of Canyon Creek and their families certainly think this is a big deal. Montanans help each other. It's just what we do. How many of us have stopped on a country road and taken the risk of helping a complete stranger whose car is broken down? How many of us have stepped up and helped a neighbor who's having a hard time? I know that wearing a mask, keeping our distance, and staying away when we or someone we care about is sick is hard. But is it really so hard that we cannot each step up, do our part, and help our community, our friends, our neighbors, and our family avoid this disease? Isn't the inconvenience of wearing a mask and maintaining appropriate physical distance worth saving a life, saving a job, or saving a business? Ultimately, it won't be rules, threats, testing, or quarantine that stops this scourge in our community. It will be each one of us deciding that we care enough to do our part. Please do your part. Everyone's health and well-being is at stake. Thank you again for coming today, and I'll now take your questions. Go ahead.
John, excuse me, this is Mike Courtrock of the Gazette. The current trajectory we're seeing in Yellowstone County, what could we see in the next couple weeks in terms of hospitalization, deaths, new cases?
Well, Mike, I certainly can't guess what hospitalizations and deaths will look like. That largely depends on the populations that get infected. I think we should anticipate the rest of July is going to be pretty rough. The measures, particularly the masking initiative, has very great potential to slow the spread. But bear in mind that with COVID-19, the cases we're seeing today were infected in the last couple of weeks. So it really takes several weeks to get a very significant impact of these interventions. So I think we're looking forward to a pretty rough rest of July.
Hey, John, this is Russ Riesinger with Q2. With that said, how feasible do you think it really is to start school?
You know, school, I actually met with Superintendent Upham and Dr. Koo today and some of the school district leadership. What we need to realize is that everything that we do with respect to COVID-19 entails some degree of risk. The more we're together, the more we have risk of the spread of disease. The more we don't do the things that we normally do in terms of school in this case, the more risk we have that's associated with social issues and economic issues and that sense of social connectedness that's so important. The school district, I can assure you, is working very hard to do everything possible to create an environment that mitigates as much risk as possible. We need to understand that it is impossible to eliminate all risks. It's when all of us do our part that we can mitigate much of the risk of infection. If we do this, what's being asked right now, in 2 weeks, we'll start to see the impact of masking and following these simple rules. That would put us in a better place when school starts. But again, we need to do these things on a regular basis, not because someone is ordering it. We need to do it because we care enough to do these things. Go ahead.
And this is kind of a two-part question. Kind of how is RiverStone Health going about testing the retirement facilities since they've kind of been seeing a spike in cases, specifically Canyon Creek?
So many of those facilities are testing on their own, and we have done, in some of the facilities, we have gone in and done the testing. So it kind of depends on the resources of each facility as to whether we do it or they do it.
And then a follow-up to that, if these retirement facilities and senior care facilities continue to see a rise in cases, again, in Lake Canyon Creek, kind of what's the next step? Is that up to the care facility, or would health organizations have to come in and kind of make a judgment call on that?
Well, you know, when we think about, right now we basically, sadly for the residents of these facilities, we have essentially locked down their visitation. That means that the likelihood of where cases come from are going to be people who come into the facility either to work or as contractors or as vendors. If we are all out doing this stuff that I've talked about, those people will be safe. Those people won't be as much risk of spreading disease. I know folks really want to have, what is the magic answer to this? It's just not that hard. Wear a mask, watch your distance, wash your hands, stay home if you're sick. If all of us do that, we're going to reduce the risk not only to the population in general, but especially to those vulnerable populations.
You mentioned that some of the outbreak was traced back to events in Yellowstone County. We have some pretty big events coming up this weekend, Big Sky State Games, the barbecue event at Metra. Should those events be going on?
People need to make their decisions about what they want to do. What I'm going to suggest to you is some of those events have contacted us, not all. Some of those events have contacted us, and we've worked through some really great mitigation strategies. Mitigation doesn't mean the risk goes away. It means we try and control the risk. As individuals, we need to make two decisions when it comes to these events. One, am I going to go? Two, if I am going to go, am I going to do it safely? Am I going to wear my mask? Am I going to keep my distance? Events can happen. We just need to do them in the right way. Part of that depends on the event organizer and how they set things up and how they build safety and mitigation into their events. And part of it depends on us as individuals deciding we care enough to do our part to keep them safe. Yes.
And do you know
John, could you give us an update on the situation as far as personal protective equipment availability in the county to first responders and healthcare workers, other frontline workers? Are we in danger of having those supplies run dangerously low? Are they already low?
At this point, we're doing fine with PPE. I've not heard anything from the first responders in quite a while. I think we have certainly enough PPE to safely take care of patients in hospitals. But as we look at these large increases in cases, and more of those, if more of those patients get hospitalized, that is clearly going to burn through the supplies more quickly. For testing purposes, we do have adequate PPE for doing the testing, but again, where that goes is much more of a question of the lab situation than the PPE situation right now. Go ahead.
Do you happen to know the hospitalization capacity here in the county, and if so, how close are we to meeting that capacity?
I don't know today how many vacant beds there are. I think what we need to remember is we have two very, very busy hospitals. And those two hospitals serve a regional population across 4 states that is 650,000 people. And they're not only dealing with the patients who have COVID-19. Our hospitals are frequently full in the pre-COVID-19 days because of people needing surgery, people with trauma, people with heart attacks, strokes, all those kinds of things. So again, the way that we decompress the pressure on those hospitals is we stop people from getting infected. And the way we stop people from getting infected, and I know some people are getting tired of hearing this, but we're not doing it well enough yet, is watch your distance, wear a mask, wash your hands, and stay away from others if you're ill. That's how we keep the hospital available for people who are ill. At this point, we have not had any limitations that have caused us to not admit patients to the hospitals. They're managing their volume fine. They've both revisited surge plans to make sure that they're prepared. But we as a community need to stop the number of folks getting infected. We need to slow that way down.
You mentioned some of the clusters being traced back to businesses. What kind of guidelines or protocols are in place if an employee does test positive? Do the rest of the employees have to quarantine for 14 days, or what is advised in those kind of cases?
Once an individual tests positive, Public Health, RiverStone Health in the case of Yellowstone County, is notified. We contact that individual and make sure they realize that they need to stay in isolation. And then we begin a comprehensive case investigation. And what we're looking for in that investigation is who could be close contacts and would need to be quarantined. We encourage businesses not to sort of willy-nilly decide that they need to quarantine or close. Let the process work. Let us determine who needs to be quarantined. The other thing that I think has been a little bit of a challenge is, and I understand why businesses are concerned, but we've had a number of people show up at testing sites that's saying, I can't go back to work until I get a negative test. I'm fine, I'm asymptomatic, but my employer wants me to be tested. Bear in mind that we do not know how long it's going to take to get that test back now with the Quest situation. So Public Health will work through that, will determine who needs to be quarantined and who needs to be tested. So we just encourage businesses to remind their workers in those situations, if you get contacted by Public Health, please respond promptly.
Do you happen to know the number?
John,
Hang on 1 second on the phone. Hold on the phone 1 second. Go ahead.
Do you happen to know the number of asymptomatic cases that have been found from these mass surveillance testing events?
I don't know from the last Saturday one or the test this week because the asymptomatics aren't back.
Right.
What we do know is we can go back to June 20th when we had the first Metro event. There were 463 or 68, 463 people who were tested. That was intended to be for asymptomatic people. We had 3 positives, and upon case investigation, all 3 of those individuals were symptomatic when they came to the Metro. So in that initial sample, which is the only ones we have all the results back on, no asymptomatic people were found to be positive. Okay, who's on the phone, please?
That was Mike. John, as far as the senior care facility cases that we've seen in Yellowstone County, it seems like several of these, I mean, they started to be uncovered around the same time. Is RiverStone aware of any direct connection between cases at multiple senior care facilities? Are these coming from vectors that have gone from one place to another?
Yeah, that's not entirely clear. What is clear is that it was when we entered phase 2, and more people were out and about and visitor restrictions came off. It was down from that we started seeing these cases. And bear in mind also the large number of cases we've seen community-wide. So it's the combination of really people being out and about, getting infected, going to work, visitors. That's why we made that kind of very focused order, restricting visitation down only to compassionate end-of-life visitations.
Here, I mean, you can't say at this point if, for example, it could have been somebody who was employed at 2 senior care facilities that could have brought it back and forth.
Yeah, we wouldn't discuss anything that would be at that level of detail because of
Okay.
the privacy that we need to maintain for everybody.
Sure. Okay.
Yes.
And you mentioned that you expect July to get pretty bad in terms of COVID cases. Do you think that's in part to Yellowstone County residents as well as out-of-town summer travelers, being asymptomatic and possibly bringing in the virus?
I think there's a lot of things that are going on. There's a lot more activity. There's a lot. We've gotten very comfortable during the days when there weren't many cases. We need to lose that sense of comfort that we don't need to worry about spreading the disease. We have many more visitors coming in, as you mentioned. We've got people who are going on vacation to other areas and coming back. So there's a lot of factors. At the risk of being redundant, all those factors are mitigated by those simple preventive mechanisms. It's not that hard. If our visitors wore masks and kept their distance, even if they were sick, they wouldn't infect people. If our family members kept their distance and wore masks when they couldn't, we wouldn't be infecting one another.
What happens if the numbers drop? Will the disease go away, or will we always have to wear masks?
Well, the governor's current order says that any county that has more than 4 active cases is subject to the masking order. So those counties that don't have at least 4 active cases, that masking order is not required. However, I think the smart thing is going to be we need to maintain our masking and our distance and our hygiene practices for the long haul. They'll be recommended when we get down to under those 4 active cases, but it's still going to be a good idea. That we've seen what in the past when we got down to a month of very, very few cases, clearly the virus didn't go away, because when we got back out and about and interacting more, we started getting more cases. So I'm just going to encourage people to make that decision to demonstrate how much they care about their community and really just take these simple steps.
So what is the long haul?
In the long term, there's a lot of things that could happen. Certainly there's progress on vaccines. If we don't get a meaningful vaccine, it's going to take a long time to reach the point of people having enough people who have immunity from having the cases. I would encourage you to take a look at an analysis that was done by the governor of Mississippi. And the question was, how long will it take us to reach herd immunity, which is essentially what you get when you're vaccinated. There's enough people who are immune that they prevent the virus from being spread. And that takes about 70% of the population. In his analysis of Mississippi, there would need to be more than 3,200 cases a day, new cases a day for a year, to reach herd immunity. It is far better that we do the prevention until we have a reliable vaccine that we can reach that immunity level through vaccination.
This might be very
John, do you have any
obvious.
idea how many county residents would die before we reach herd immunity? I mean, I know these are analyses, they're estimations, but I mean, how many people would die in our county for us to get there?
Yeah, you can do the math if you want to, but it all depends on what the mortality rate is. So I really wouldn't want to hazard a guess at that. You know, think about this. In order to get herd immunity, we need 70%, which is, if my math is right, is around 120,000 of us would need to be immune, either through getting the disease or being vaccinated. It's a large number.
Yeah.
Okay. We have a question in the room here. Please go ahead.
This might be obvious, but you're stating that you're having trouble doing contact tracing, that part of the case investigations is stressed. What's the impact of that?
We've got a lot of people doing this. As I mentioned, we've hired a number of people. We have a lot of our own staff who are redeployed to that, and a lot of our own staff who are working evenings and nights and weekends to do it. The more cases we have and the more contacts there are, the longer it takes. So we contact the individual who's positive very quickly to notify them that they're positive and they need to go into isolation. We are, it's about 1 to 2 days to get through the process right now. So we're about a day or two, working on cases a day or two old on the investigation. They've all been notified, but the investigation, we're working on cases a couple days back. The more cases we have, the harder it is, even as we continue to hire more staff. And again, we are looking for more people who want to be a part of this solution. So if there are people out there who want to come in and join us and work on this, we are accepting those applications.
How many more do you need to feel confident that you can keep it to that 1 to 2 day turnaround?
We probably, right now, we could probably use 5 or 6 more FTEs. Many of these people work part-time. So the equivalent of 5 or 6 more people who are working full-time would be great.
John, you've been tasked with being, kind of the spokesperson for the county as it confronts this pandemic. Do you feel that other community leaders need to step up and offer more support to the efforts of RiverStone and the rest of the Unified Health Command? Do you think that local leaders need to be more vocal and encouraging people to do what's being asked?
You know, we worked very closely with elected officials, with the hospital leadership, with our business leadership, and really we've had very good shared efforts. I think where we really need to get to is that the understanding is from people in our community that it isn't the public health agency, it isn't the hospitals, it isn't only the elected officials that need to step up. It's every one of us needs to step up. When that message resonates, when people realize I as an individual can do my part to save my community, then we'll start to make much more progress. So we've had great cooperation and help from those folks, but we really do need all of the individuals, not just the leadership. We need every person to do their part. Any other questions?
I guess just for clarity moving forward, if you think that you have COVID-19, what are you supposed to do?
People who are symptomatic they can go to the testing site at the Shrine Auditorium in the mornings for now. That's going to be the challenge. You can also see your medical care provider or talk to your medical care provider and get an order and go to testing at St. Vincent Healthcare. There's also the viral triage unit at Billings Clinic. Right now the state public health lab is running those tests on symptomatic people, and so there are ways to get a test. People just need to go out and do that.
So we're kind of back to where we were in March and April, where you need a doctor's order to get the test, at least 2 weeks, 3 weeks out from now?
Yeah, if you show up at our testing site, and again, our testing site is a little bit uncertain right now because it depends on what becomes of the capacity. Symptomatic people, we will test under a public health order, and we'll send those in. But if the other option is to go through your medical care provider.
Do you know how many people hospitalized right now in Yellowstone County are got COVID or their coronavirus connected to the senior care cases you've uncovered?
I do not.
Okay.
Any other questions? Thank you all for coming. Please go out and do your part. Thank you.
Yellowstone County Health Officer John Felton live from RiverStone Health this afternoon. He says a pretty rough rest of July. Those are his words. He says this outbreak has stressed our public health system to its maximum. They have hired 17 people and are now looking for more to help down at RiverStone Health. There have been 458 new cases